The topic of this video lecture are risk factors of the allergic disorders and allergens. The earliest report of allergic diseases is that of King Menes of Egypt, who succumbed to the sting of a wasp at some point between 3640 and 3300 before Christ. The astute Roman philosopher Lucretius observed exaggerated responses in some humans to usually occurring substances but not in others, and remarked, "What is food for some may be fierce poisons for others." But the concept of allergy was originally introduced in 1906 by the Viennese pediatrician Clemens von Perquet, after he noticed that patients who had received injections of horse serum or smallpox vaccine usually had quicker, more severe reactions to second injections. Now, allergy is used to describe a hypersensitivity reaction initiated by immunological mechanism. Allergy is not a disease itself, but a mechanism leading to disease. In clinical practice, allergy manifests in form of various different conditions, such as anaphylaxis, urticaria, angioedema, allergic rhinoconjunctivitis, allergic asthma, serum sickness, atopic dermatitis, as well as a colorful spectrum of food and drug-induced hypersensitivity. Allergies can be seen in almost every organ. Most commonly, however, it's the skin and mucus that are involved, since they represent the frontier between the individual organism and its environment. Allergic diseases are a number of conditions caused by hypersensitivity of the immune system to something in the environment that usually causes little or no problem in most people. Allergic diseases are common, and their prevalence is increasing to epidemic proportions. They are affecting the lives of more than 1 billion people worldwide. With an epidemic rise during the last 60 years, their prevalence is expected to reach up to 4 billion in 2050 years. In both industrialized and industrializing countries, they affect between 25 to 50% of the world's population, having a noticeable impact on patients' quality of life and incurring significant costs. Allergic diseases can occur at almost any age. Some allergies are most likely to develop for the first time in particular age groups. The prevalence of childhood allergic diseases such as allergic asthma, allergic rhinitis, and atopic dermatitis has increased exponentially. Atopic marsh, sometimes called allergic marsh, refers to the natural history of typical progression of allergic diseases that often begin early in life. As a child grows, so also their atopy, for example eczema, is most likely to occur between birth and 3rd month of age. Food allergy is most common in 2nd year of life. Nasal allergy manifests itself between ages 3 to 7 years. Asthma onset most likely to occur when a youngster is between 7 to 14 years. Risk factors of the allergy are genetics, allergens exposure, environmental pollution, urbanization, and stress. Hereditary predisposition to allergies is reflected in the term atopy, introduced to refer to allergic constitution, a genetically mediated predisposition to allergic reactions. Familial predisposition to allergies is associated with polygenic inheritance. Different genes provide the ability of the immune system to develop a primary immune response with the production of IgE to a particular allergen. The ability of the immune system to build up a high level of specific IgE. High functional activity of T helper type 2 in the production of interleukin 4 and 5. High reactivity of the bronchi and skin. The basis for an allergen's role in allergy is that increased exposure can lead to sensitization, and re-exposure to the allergens in a sensitized individual will increase the risk of asthma development and other allergic diseases. The most common routes of allergen exposure are inhalation for pollen and spores, injection for foods, drugs, or injection for insect bite. But exposure can also occur by other routes such as skin contact or infection. Continued allergen exposure can increase the risk of allergy. However, allergen avoidance or desensitization will improve symptoms. To this we can add the following factors: the peculiarities of infant nutrition, in particular early transfer to artificial feeding, eating disorders in adults, irregular intake of food, violation of the ratio between the amount of food products, and abuse of one type of food. The likelihood of developing allergies could potentially be decreased through exposure to microbes in the early stages of childhood. A plausible reason for the higher occurrence of asthma and other atopic diseases in industrialized nations is a relatively low rate of infections or exposure to microbial products in these countries. A variety of epidemiologic data demonstrates that being exposed to environmental microbes during early childhood, particularly those found on farms and not in cities, is linked to a lower occurrence of allergic disease. The hygiene hypothesis was formulated based on this evidence, proposing that exposure to environmental and commensal microbes and infections during early life and even perinatal stages encourages a regulated immune system maturation, possibly leading to the early development of regulatory T cells. Consequently, individuals who experience early life exposure to environmental and commensal microbes and infections are less inclined to develop T helper to responses to non-infectious environmental antigens, and therefore less prone to developing allergic diseases later in life. Infections caused by respiratory viruses and bacteria can contribute to the development of asthma and can worsen pre-existing asthma. Up to 80% of asthma attacks in children are believed to occur following respiratory viral infections. Also, it may appear inconsistent with the hygiene hypothesis. The infections linked to asthma are caused by human pathogens that can potentially harm pulmonary mucosal barriers. The evidence that supports the hygiene hypothesis concentrates on exposure to various environmental bacteria that may not necessarily cause tissue damage. Some epidemiologic studies indicate that a failure to colonize the respiratory or gastrointestinal tract early in life by particular commensal microbes can increase the risk for respiratory viral infections that induce asthma. Environmental changes are thought to be the main factor in the rapid increase and worsening of allergic diseases. It's known that city dwellers suffer from allergies more often than villagers. Normally, the bronchial epithelium produces mediators that reduce the bronchoconstrictor effect. Under the influence of pollutants, the airway epithelium is damaged and neuropeptides are released, which triggers the neurogenic components of inflammation. Pollutants also contribute to the activation of arachidonic acid metabolism and suppression of antioxidant defenses. Pollutants activate bronchial epithelial cells with formation and secretion of pro-inflammatory cytokines. Exhaust particles also activate airway epithelial cells with release of pro-inflammatory cytokines. Tobacco smoke is not only a respiratory irritant, it weakens the protective functions of the mucous membranes of the respiratory tract, contributes to easy penetration of allergens, and contributes to the development of bronchial hyperresponsiveness. Tobacco smoke has cross-allergenic properties with plant pollen. An allergen is a type of harmless antigen that causes an abnormally elevated immune response in the sensitized body and to which most healthy people are tolerant. The broadest definition of an allergen is any molecule that binds IgE antibodies. A major allergen is an allergen that is recognized by IgE antibodies of more than 50% of patients allergic to the allergen source. A minor allergen is recognized by less than 50% of the allergic population. Properties of the allergens are relatively small molecular mass, capacity of absorption and aggregation in small particles, thus diffusing mucous secrets and integumentary tissues without evident defects of the latter. High solubility and easy elution in liquid media of organism. In vivo chemical stability. Allergens do not metabolize easily, at least. Among proteins, the most frequent allergens are enzymes, proteases. Non-protein allergens are distinguished by their capacity to join protein compounds of own organism and named heptans. Allergens can have an effect in very small doses. For example, a significant pathogenic total dose of ragweed allergen is 1 microgram per year. All allergens fall into two large groups. Endo-allergens, formed within the body, they can be cells damaged by infection, chemical, physical or other influences. And exo-allergens, substances that affect a person from the outside. In turn, exo-allergens are divided into two large groups, infections and non-infectious nature. Infectious allergens include antigens of bacterial, viral, fungal, protozoa and helminth antigens. Allergic reactions mainly occur upon contact with opportunistic and non-pathogenic microorganisms, less often with pathogens. Non-infectious allergens include pollen, food, household, epidermal, insect, medicinal and industrial allergens. Allergens are divided by the way they enter the body: inhalation, ingestion, injection, skin contact. Also, allergens are classified according to their origin: animal products, foods, insect stings, mold spores, metals, plants pollens, drugs, and other. Allergenic sources can vary from biological sources with very complex composition such as pollen, house dust, meats, or foods, to single molecules such as chemicals or drugs. The allergenic source contains unique allergen molecules and cross-reactive ones. Most, but not all, allergenic molecules are sensitizing, which is defined as the ability to induce allergen-specific IgE antibodies. Non-sensitizing allergens can only cause allergic symptoms if previous contact with are related. Cross-reactive allergen has caused sensitization. A prototypic example of a sensitizer is birch pollen, and a cross-reactive non-sensitizer in homologs apple and pear nut allergen. Allergen names are based on the scientific Latin name of the plant or animal species from which the allergen originates. For example, the major allergen from birch pollen, BET-V1, is named after the scientific name of the tree Betula verrucosa, in which Betula is a genus and verrucosa is species. The first three letters of the genus bat and the first letter of the species V together form the basis of the allergen name, followed by a number. In principle, the number is given in order of discovery, so bat V1 was the first allergen from birch pollen that was discovered. To indicate how the component was obtained, the letter R recombinant is placed before the name if the protein is recombinant, and the letter N if it's natural. Many allergens have molecular variants or isoforms. Different sequences of an allergen with more than 67% sequence identify attempt isoallergens. One isoform is mainly found in birch pollen, RBAT-V1.01. Some isoforms are so closely related, more than 90% sequence identity, that they can usually be considered identical. If they need to be distinguished, two more digits are added to the name, for example, RBAT-V1.0102. Thank you for your attention.